So why would you use push patch to get doses of NAD, glutathione, and BPC as compared to traditional injections or IV infusions? Well, number one, because it's just easy, right? So I know a lot of people when they think iontophoresis, they don't know what it is, or they're thinking of the old-fashioned iontophoresis where you have to wear like a belt clip and wires hanging around, which obviously no one wants to do that. With the new technology we have, here's your iontophoresis patch, very easy to use. It has its own microprocessor, so very simply, we basically ship the NAD, glutathione, or BPC, whatever you want. We do ship it in powder form, which is very important. What you have to remember with all of these molecules is once you add water to these or saline, they break down really quickly, and the shelf life is much less than even 30 days. So you want them to be as fresh as possible. So that's why we deliver it in powder form. The patient has this. They simply add 1.5 mLs of water to this, go back and forth a few times, and then you're going to take the molecule, put it on the patch, spin it around. It'll be on here, and you apply it. So very easy to do. The other huge advantage of this is obviously, you can put it, with BPC 157, we'll talk about, obviously if you're injecting BPC 157 due to the short half-life, 30 minutes, you're going to have to inject it, 4 times a day to get a good dose effect. Who wants to inject themselves 4 times a day? When you use the patch, you simply take the patch, put the medication on it or the molecule on it. And, if it's lateral epicondylitis, you put it there. If it's neck pain, you put it there. And you're getting dosed for 12 to 14 hours. It simply can't, much better than injection. And orally, BPC 157 is orally available, but the problem is you lose about half the strength. So, if you want to get a 300 microgram dose, you're going to have to take 600 micrograms. And remember that short half-life, you're going to have to take that 600 micrograms multiple times every day, which gets very expensive. So iontophoresis for BPC 157 makes a lot of sense. It's much less expensive and much more effective. The same thing with NAD and glutathione. NAD, glutathione, those IVs, although effective, it's a 3 to 4 hour IV. And who has time to sit around and do a 3 to 4 hour IV? And the other thing is the very short half-life. So even if you get your 3 or 4 hour IV, remember the half-life of NAD is an hour to 2 hours. You kind of lose the effect of it after you come off the IV within an hour or two. So you just don't get a big dose effect. With the patch, the reason I love these things and our patients love them is, if you have a really big day and you want to be on your A game, because anyone who's done NAD knows that when you have NAD and your levels are up, you're mentally sharp, you have more energy, and your cardiovascular probably improves 20%. It's crazy. You put the patch on in the morning and you go rock your day out. And you feel amazing all day. There's no side effects. And at the end of the day, or when the 12 or 14 hours up, you pull the patch off. It's that easy. So that's why the iontophoresis delivery method for NAD, glutathione, and BPC makes a lot of sense.